We're on part 5 of our week-long discussion about power consolidation in the United States, and today I want to talk to you about healthcare. Did you realize that over 45% of Americans who are insured are covered by just 5 health insurance companies? That's correct. 140 million people are covered by just 5 health insurance companies in the United States. Hello, my name is Brian Kennedy. I'm the mayor of Glendale, Wisconsin, president of Democratic Municipal Officials, and a member of the DNC. Follow me for local government and Democratic Party content. So insurance companies are businesses, and businesses want to make money. Now, this may seem pretty elementary if you've got a background in finance or accounting or economics or business, but if the way a company makes money is by bringing in more revenue than they spend. So for insurance companies, that means they're trying to get as many of us to become policyholders or customers, and then they try to pay out as little as they can get away with paying out and still satisfy the policies that we have purchased. So how does that work? How do insurance companies try not to pay out for different services that are a part of policies? Well, the first thing they do is roadblocks. If you need to see a specialist about a special condition, you need to often to see a primary care physician first and be referred. So they put some gatekeepers on the process. Another thing they do is require prior authorizations before a lot of procedures can be done. And then for medications, they create formularies, which means they create tiers of coverage, and the cheapest medications are in the first tier, and they're much more easily covered. Then there's a second tier, which requires a little more screening, then a third tier, and then some of them just have certain medications they won't cover at all. They're not a part of policies. And so they create these obstacles to try and make sure that they are paying as little as they can get away with paying so that they can maximize their profits. So let me share with you a personal example of my own interaction and my family's interaction with our insurance company. This happened a few years ago. When I was age 11, I was diagnosed with a condition that's easily treatable with medications. Some of them are less expensive, some of them are more expensive, and throughout the course of a little more than 40 years, I've pretty much tried them all. My doctors and I have worked to make sure we have me on the one that works best for me with the least amount of side effects. Unfortunately, the one I'm taking happens to be the most expensive one on the market. So a few years back, I buy my insurance through the exchange, and a few years back, I had to switch insurance companies. I found a better plan, or what I thought was a better plan, and as soon as I got on that new plan, the first time I went to have a prescription filled, it was denied. They wanted me to try the less costly alternatives first. So I had to go through an appeals process where my doctor and I had to compile years of medical records to show that I had already tried all of the other medications. The reason I was on the most expensive one was because all of the others had either been ineffective or less effective, or it had side effects. And so I eventually did win that appeal, but the insurance companies know that if we have to appeal, if we have to exert our time and our effort and our resources to fighting them to get coverage on what should be covered under our policies, many people will either pay for it out of pocket or just give up. They'll just take the less costly alternative, even though it isn't as effective or doesn't have the best outcomes for them. We have a healthcare system that was originally based on market competition. So that meant that there would be a lot of different insurance providers who would be competing in a marketplace, and we as consumers could choose which policies best suited our needs. And if we didn't like that particular policy or that particular company, we could go with somebody else next time around. The problem is that so many of these companies now have consolidated that, as I indicated at the beginning of this video, 45% of all the insured people in the United States are covered by just 5 major insurance companies. And so they've become essentially regional monopolies across the country, which means that a lot of the competition that originally existed in the marketplace is largely gone. So I guess to conclude, we are stuck with a consumer-based system that no longer gives consumers the same level of purchasing power that they used to have, because the large monopolies now control much of the health insurance process. So there are other ways to do this. I'll get into that into a future video. But the point of this week's discussion was to show power consolidation across a number of different sectors of American society and America's economy. And so this is an example of how healthcare and healthcare consolidation has essentially squeezed the consumers. We're sort of stuck with a handful of large insurance companies who are dictating what the policies look like, what their payouts are going to be, and you have to essentially go and fight them if you want to get the full coverage for the things that you know that your policy should cover. It's also one of the reasons why our health insurance has become so expensive, because there's no longer competition in a free market system.